Well, good afternoon, everyone. Continue to enjoy your lunch. You know this is a real LA lunch when Antonia has her little portable Tabasco sauce that she's whipped out of her purse to put onto her salmon. So a true LA event. But we're really appreciative of being, again, the presenting sponsor of this event. We've been doing this, I think, for 6 years now. And it's one of those important forums for us at the bank and also for our nonprofit and foundation partners because this is a gathering of the family. And so on behalf of all of us at the Bank of America, especially I want to recognize Raul Bustillos, who serves as your co-chair on your Corporate Leadership Council, and Danielle Campos and Stephanie Lomibao from our National Foundation, who were fortunate. They live here in LA. So this forum and these relationships with Southern California grantmakers has really shaped the bank's approach to philanthropy, not just in LA, but all throughout the country. And so these sessions are helpful to all of us, helping us think about the needs of our community, helping us to think about unmet needs, whether it's affordable housing and homelessness or disconnected youth. These forums have really shaped that for us, certainly at Bank of America. And so for the last few months at Bank of America, our colleagues, we've been going around talking to our clients and our nonprofit partners with a simple, but I think a very profound question, which is, what do you want the power to do? What do you want to achieve? Because as you think about the needs here in Southern California, it's way beyond any single foundation, any single agency, any single corporation. And so that question really has a lot of power to it, which is, what are the needs? How do we build capacity among our communities? And so hopefully some of that will come out from today's session and certainly with the session that we're about to have. So now it's my pleasure to introduce the afternoon plenary session. And your session moderator is Chris Haney. He's the Executive Director of the California Budget and Policy Center, which engages in independent fiscal and policy analysis and public education with the goal of improving policies affecting the economic and social well-being of low to moderate income Californians. And that's really why we're here today, to figure out how do we empower the communities that we serve to an even greater level. So with that, let's welcome Chris.
Thanks, Garrett. Appreciate that. So hi, everyone. It's nice to be back with you here again this afternoon. I'm going to be joined by our panelists shortly, who I'll introduce. But I just wanted to say what we're here to talk about is housing and healthcare and what the proposals are that the state's looking at from a public policy and a budget perspective this year. And a couple of you are probably thinking, well, why housing and healthcare? But we've covered a number of the other budget proposals in other ways, both in the morning plenary and in some of the sessions thereafter. And housing and healthcare are fundamentally connected. Maybe not sometimes from a budget and policymaking perspective where they often get made in different silos, as we were talking about this morning, but they're very connected in the way that families live their lives, right? If you're looking at everything in your world from a family budget perspective, your number one expense is always your housing costs, and your number two expense, depending upon whatever your household composition is next, is either healthcare or childcare. And those combinations of things fundamentally determine how you feel about how you're doing economically in the state. And so we're here to talk about housing and healthcare, and I have two very distinguished people joining me here today. Antonio Hernandez, the CEO and president of the California Community Foundation, a friend I'm sure that to all of you have known very well. And my friend and colleague, Lisa Hershey, the executive director of Housing California. Lisa and I share a building in common in Sacramento. So if you ever come to Sacramento and you need to do business on something related to state, you're welcome to come visit us at our offices. And have also been sharing trade secrets about how to be executive directors of organizations. And so she's been a good friend and confidant in that regard. Those of you who fund nonprofits know there's a little bit of an art involved in that process as well. So I'm supposed to start off by just telling you a little bit about what's in the proposals this year, although Lisa's going to walk through probably some of that in a little bit in her comments too on the housing front. But let me just say a little bit about what's there. And if you remember back when Gavin Newsom was running for office, he was talking about a Marshall Plan for housing, and everybody was kind of wondering, well, what does that mean, right? It sounded big. And so we were waiting to see what the proposal would be. And I think, although he hasn't been using that language that I've heard very often since then, the first set of budget proposals that have come out give us an early snapshot of what that might look like. And there are three ways that he's coming at that so far. The first one is he's actually reestablishing a stronger role for the state in housing policy. Doing that by basically saying the state's going to play a bigger regulatory role and is going to use more carrots and sticks in terms of how it monitors the supply and building of affordable housing and the housing supply more generally at the local government level. One of those sticks that's gotten the most attention, of course, is his threat to withhold transportation funding from local governments if they're not meeting their housing element shares, although he's backed off a little bit from that in recent weeks. The second area that he's doing, he's proposing some help on the housing front is by using the state's existing tax credit and loan programs that it provides. So for instance, a $500 million increase in the low-income housing tax credit and some other areas where he's providing, using the existing programs, expanding some funding to sort of help with the supply of housing. And then the last is a whole series of proposals in the homelessness space. And we should talk more about the connection of all those, and I'm sure Lisa's going to mention that. But there's a whole series of proposals around some dollars, additional funding for shelters, additional funding for showing that you're making progress on actually establishing and building the shelters, streamlining the regulatory process for allowing the shelters to be put in place, streamlining the dollars from the ballot measures that were passed in November that put dollars in place for homelessness support and mental health support on the table more quickly. And some things like that. So there's a variety of homelessness proposals that are there. And all of that together sort of makes up the housing and homelessness agenda. I've probably forgotten some things you'll hear about shortly. On the health front, the fundamental story there has been the success of the state's very aggressive expansion of the Affordable Care Act. And we have, in a very remarkable social change, good public policy story, taking the state's uninsured rate from being almost 19% before we implemented the Affordable Care Act and expanded Medi-Cal, or the state's Medicaid program, taking that rate down to about 7%, right? Really a remarkable change. And then the question is, okay, if we wanted to get to universal health care, what's left, right? Well, who is that 7%? And the answer to that is about half of that 7% are undocumented adults. And so the key proposal in the governor's budget is a proposal to expand Medi-Cal coverage to adults 18 to 25 years old. So sort of taking the first swath of the population that's next. The state made a decision a couple of years ago under Governor Brown and with the state legislature to expand Medi-Cal to undocumented children. They're now proposing to take the next step to 18 to 25. They're also proposing to expand some subsidies for Covered California. That's the state's market-based exchange. And there has been a problem in the Affordable Care Act, if you followed that over time, that if you're not low income enough, basically if you're sort of in that kind of just above the income threshold, which is 250% of the federal poverty line, but you're still in that lower income arena, you're in a place where you don't get Medicaid or you don't get Medi-Cal, but you're not getting subsidized premiums. And so there's this gap where a bunch of people are paying really high healthcare costs and not getting any help. And so Governor Newsom's proposing to expand the subsidies to provide health insurance to 250% to 600% of poverty, essentially taking that next swath of folks and providing them with some additional coverage. So those are the big pieces here. And so the question for you all to start is, what do you think about all of this in the worlds in which you work, and how is it affecting what you're working on this year? And Lisa, we'll start with you.
Okay, great. Well, thank you, Chris and Antonia. It's a pleasure and an honor to sit with you today and to be with all of you today. I will just say my background is actually in public health. I did 25 years in state and local public health policy, and I came into housing through a social terms of health lens. And as you've heard all day, this governor is really taking a holistic approach to create structural and systems change in California. And from a public health perspective, social determinants of health perspective, that is a dream come true. So it's an honor to be here. In my space in housing and homelessness now, and through the lens within which I view the world, really happy to first hear the governor say housing and homelessness. Our past governor said it in his final year with us. So this is just coming out of the gate in a completely different way. In his inaugural address, Governor Newsom declared, "In our home, no one should live in constant fear of eviction or spend their whole paycheck to keep a roof over our head. Chris just spoke to the Marshall Plan for housing, which is really exciting to think long-term structural changes for short-term and considerations of short-term solutions. And he also said, lift up the fight against homelessness from a local matter to a statewide mission. So that alone is so profound to us. So we're really encouraged to see he's also put the money or proposed investments where his mouth is. It's good policy, potentially good policy, and good politics, as well as investment to follow. This is also an opportunity for us to see and be excited and find places of alignment and recognize that there's really important opportunities for all of you and all of us to work together on a couple of key issues, which I heard resonate strongly this morning. We need to make sure that the resources, the government resources and policy are invested to serve the people who are struggling the most in California. And along those lines, currently, the way the governor is looking at the policy and the budget proposal and trailer bill language, you've got affordable housing over here and you have homelessness over here. These two need to be aligned conversations. As many of you know, they need to connect. They are part of system and structural changes. And if we're going to ensure to meet the needs of California, we need to make sure that we are serving people struggling the most. So people with 50% or less of area median income, people living on our streets and in our cars experiencing homelessness or housing instability.
And Antonio, this is certainly, both of these arenas and their interconnections are certainly no secret to the work you've been doing over the years. And so how do you see things aligning for that work that you have been doing and where you see things are going next?
Well, first, to begin with, I would like to say that it's wonderful that the governor is focusing on housing, because you cannot access health care if you don't have a place to live. If poor people are moving from apartment to apartment because they cannot afford it, and most people are one paycheck away from homelessness. And you're absolutely right, we need to bring together, because we have a homeless crisis and a housing affordability crisis. So I'm very happy that, some focus, and we have to deal with the regulatory obstacles that allow for faster movement of building homes. As to the health, I'm very pleased with what California has done. And I think moving towards the goal of providing health insurance for everyone is wonderful. But one of the key questions and barriers is access. For many of you who work in this arena, in the health arena, so you get Medicare, so you get Medi-Cal. If no doctor will give you the services because they're not getting the reimbursement, access is a real key issue. We're making progress on coverage, but not in access. The other thing too that is really important is, as you look at the entire sort of health issue, you have to deal with the cost issue. And if you don't deal with the big cost factors of pharmaceuticals, drugs, and hospital expenses, and think about your life, up till you get to be my age, you need access to a doctor, and that's a very small percentage of the cost. The cost that we are spending now is in the last years of our lives. And we have to find a way to control those costs so we can spend the money on most of the population that really needs it. The other caution I would make, and this is a big issue. CCF, we're very involved in housing, in health, in education, immigration, you name it. And one of the important things to keep in mind, all of us who are advocates, and I've been an advocate most of my life, is be reasonable in what you're asking for, because you have the conflict of so many people asking for so many things. And at the end of the day, we can only pay for so much. And so the question is, how can you best spend our tax dollars in a way that are profound and really advocate for change? And final thing I would say at this point in time is that I'm very happy that the governor has really focused on early health. If we start early in prevention and healthy, we're going to be better off and we're going to save money. And this is the first time, because we've been, sort of pushing for early childhood support and, 0 through 5 and all this stuff. It's the first time that this governor has really put this up front. And I think that he should get a lot of kudos for that. The question is, how are we going to do it? How are we going to make accessibility to poor and middle class folks? Because those are the folks that really need it. And I think, it's 210,000 or some whatever numbers of increase of available seat. It doesn't hit anywhere near the need of it. So I really think that California is in a great position to be an innovator. But we ourselves in the nonprofit and philanthropic world have to understand the limits of what government can do. And it's what we can do with government that's going to make the difference.
That's great. And one of the things I didn't mention in my opening remarks is that there is an early effort in the governor's proposal around the cost side. It doesn't have a lot of specifics to it, but it does actually say, look, it charges basically the state agencies that are involved in working with pharmaceutical companies, as well as some of the hospitals and other representatives that take a lot of state dollars, basically says, look, I want you all to coordinate, use the weight of the fact that you are a major customer, and start pushing back on pharmaceutical costs. And we'll see what that means, but the state is a major customer along with some of the folks who are recipients of state funding. And so that piece is, at least in the contours, is in the governor's proposal. Lisa, one of the things that's unique about your membership is you have this incredible diversity of types of people and organizations that are in it, in the sort of sense that you have everything from like the legal assistance for homeless folks to like the housing developers, right? So how does what you all are saying needs to be done in the housing arena align with where some of these proposals are going, and sort of where is there some pushback coming from those folks in your membership?
That's a great question, and our board very much reflects the diversity of our constituencies which we serve, which you just referenced really, really well. The way that we think about our work at Housing California, because of how we serve kind of across the continuum in our niche, is we really do use the 3 Ps, which some of you may be familiar with. So production, preservation, and protection. And that allows us to think, again, holistically and comprehensively about what we're trying to accomplish and who we're trying to serve, starting with the why. So for the production, and this aligns very well with the governor's budget, there is an intention through the tax credit allocation to increase and jumpstart production through the low-income housing tax credits. What we know with that, we want to see that expansion. It is an evidence-based program, so that's exciting for us, but it is not going to serve some of the people I'll get to in a minute around protection. The second bucket is preservation. There is a certain amount of affordable housing, affordable to people who have the lowest incomes in California, but a lot of it's coming out of its covenants. It's coming out of preservation, and we're not keeping up with that. So we really need to pay attention to and ensure that there are resources to keep that housing stable for people who need it most. And then the third bucket that is really comprehensive and allows us to include the people that we care about is protections. It's protection from people being evicted from their homes. It's protection for people so they have housing stability instead of housing insecurity, and it's for people who have already fallen into homelessness and finding the pathways out of homelessness. And so through these 3 Ps, it allows us to listen to, learn from, and lift up from our different constituencies, as well as advance policies that are well-informed to make this possible. And I will just note that Housing California has really transformed into both a treetops. We do a lot of lobbying in the building, but we recognize that we're missing the people most impacted by the policies that we were trying to create. And so we've developed this Residents United network, which is 1.1 million people living in affordable housing. And they are such an important part of the voice. And they're not just looking at protections for themselves. They have benefited. They have experienced the inequities. They've benefited from having a full place to call home. And they are some of the most influential voices in the Capitol, not only telling their stories, but advancing Proposition 1 and 2 on the ballot to ensure that there's more financing for more affordable homes for all.
So you didn't address the one issue that I thought you might, but
Okay.
I did want to sort of give
It
you
would
a chance to
tickle.
talk about it,
Yeah.
which is on the protections front, or I assume
Yes.
that's the bucket you would put it in. There is, at least on the legislative front, an effort to try to bring back something that looks like rent control. Did you want to say a few words about that, or?
No?
Okay.
No. Yes, no. And so
I'll
what?
say it if I-
Do you want to talk? Yeah, I will just, how about if I tee it up? And then, Antonia, I'd love for you to speak for. Obviously, protecting people where they are is critical and core. And we work in very strong alliance with several tenant protection groups, even though that's not our primary bucket of work, because we recognize that most people are being impacted by housing affordability, particularly people with the lowest incomes. And so there needs to be opportunities, which we do through our Residents United network, in alliance with other groups that are identifying ways that work within their jurisdictions to do that work well. I will say that there are some state laws that we need to reverse, like Costa-Hawkins and a variety of things that are stopping the ability of localities to determine what is the best way to stabilize rent for their communities and advancing those solutions in a very thoughtful way.
Well, you answered it really well, so I don't have to add much to it.
One of the things I did want to say is this is a relatively short session. We're going to open it up to questions here shortly, so if you have questions, start thinking about those. But I want to ask one question of both of you, and I'll start with Antonia, about the role of philanthropy and how it works with these kinds of budget proposals that we've been talking about, and if you have any examples that the two of you can think about of sort of the way that philanthropy has worked effectively on policies like these in the past.
Well, we at the California Community Foundations are very attuned to the issue of systemic change and community empowerment. And so we fund efforts to systemically change conditions that are hurting poor people. As an example, we were the main funders, nonprofit philanthropy funders on HHH and H, and community and getting out the vote. We're very involved right now on the parcel tax for LAUSD. I think it's really important for philanthropy. You know, you have to feed the hungry, but then you have to ask the question, why are they hungry? And go to what's preventing them from being able to get the food. So you have to work at both levels. And I think philanthropy is beginning to realize that we need to advocate at the local level, at the state level, and at the federal level. And you know, I'm on the board of the Center for Budget and Policy Priorities in Washington, D.C. And I want to thank, Chris, because very few organizations focus on tax policy affecting the poor. And that's where the real challenge and power is, to be able to provide for poor people. If you think about, food stamps, if you think about all of the programs that are available for poor people and middle-class people, focusing on budgets. And, budget and tax policy are not sexy issues, but that's what matters. If it's not on the budget, it doesn't get done. So I think that philanthropy should more and more focus on those tax and budget policies that affect the poor, because it's going to go a lot longer as far as having a positive change on people's lives.
Yeah, I want to definitely do this. I totally agree with you on tax and budget policy, absolutely. I'll just add that to help shape this conversation and think about how philanthropy can really help align with the governor's budget and advance powerful policy. I've heard so much of it already today here. At Housing California, we have a vision for a California where no one lives on the street or in a car, and every single person has a safe, affordable place to call home in a vibrant, inclusive, and prosperous communities. And we reach for that through 3 strategic directions. And I think each of these strategic directions are ways that you can inform and influence, advance, lead, and contribute to in a C3 or C4 way. Our first strategic direction is to set a new frame and change the narrative around housing and homelessness in California, from an individual issue to a systemic solution. That's what's created, and that's the conversation we need to have to get us out of it. Secondly is to build power through multi-sector coalitions, which are, key and core to everything we've talked about today, and through community organized networks. So that is C3 work, public information education, and then integrating into C4 work for true advocacy for specific issues. And then the third is advancing pinpoint policy advocacy. And there's 3 ways to do that each of you, California Community Foundation, is key and core in encouraging and this systemic change. One is in the Capitol, through budget and legislative change. Secondly, once those bills become a law, ensuring they are equitably implemented across the state. And I cannot say that enough in terms of how that plays out among communities of color, communities with disabilities, and other that have experienced inequities, but also in Southern California. And then third is at the ballot. We helped lead Proposition 1 and 2, bringing in $6 billion. But the only reason that was successful for us is because multi-sector, all of you being involved at some level and advancing that on the local level, regionally and statewide. So as we think about that, and we think about California Community Foundation, who has not only supported the systemic work for us, some of our most progressive work in the Capitol around getting the Affordable Housing Sustainable Communities money, the only money we had for housing for many years in 2014, to supporting us through some of the organizing work for the campaign, they endorsed Proposition 1. So leading in that change. Conrad and Helton Foundation invests deeply and supports the advocacy around homelessness, well, indirectly supports advocacy. I know I need to be careful here. We have the only full-time lobbyist who works on homelessness based in Sacramento. We work very closely with Sharon Report from Center Community Change, but that's how small the capacity is. We have over 200 bills in the legislature. I have 2 lobbyists. So I think as you think about capacity, not just for Housing California, but all of the organizations that are doing capacity. Some of you are investing directly or indirectly. We work on census through the California Policy Advocacy Network. Irvine Foundation, the California Endowment. I mean, most of you in the room could probably lift your hands, and you're doing such critical work around that. I could go on and on because I've been working in this work for a long time with the California Endowment, Kaiser Permanente. Most recently, the San Diego Funders to End Homelessness and the San Diego Foundation submitted a letter to support our budget proposals. That and the collective that you represent is so powerful. And the last thing I'll say to you, and I've said this to several of you in the room, is the Bay Area has a very strong influence in the legislature right now. They own both of the housing committees, their chairs. We need you, your voices, someone mentioned this morning, the small, beautiful efforts that you've innovated. We need to lift those up. Because there's so much richness in Southern California, from LA to Inland Empire to Coachella Valley to San Diego. Like, there is so much richness here, and we need you. We need you to make this happen and ensure that we are not only informing policy with your expertise, but equitably implementing it to make sure you have what you need and the state is served completely.
And let me just say one thing about this thing. The votes are here. We voted for those people out there, okay? And you cannot forget that. They tend to forget that, okay? And we need to remind them that the votes are here. They're not in the little she place called the Bay Area.
And I wasn't trying to set up the politics, but we are feeling it, so thank you for bringing that. We need the balance of state and power. We do.
Right. That's right. So it's your turn. We have questions. If you have questions, please raise your hand, and when a microphone comes around, identify yourself and then pose your question. We'll get in as many as we can.
So you're the diplomat. God, no questions?
We got one back here.
Excuse me. This is Stephanie from Bank of America. Hi. All the way in the back. My question is around the connection between housing and mental health. Because I know from a chronic homelessness perspective, mental health is very underfunded. So could you speak to what California is doing in this space? And in particular, how all 3 sectors, philanthropy and business, and nonprofit and government can work together towards that common North Star?
Well, let me just start by saying that it's only recently that we all collectively have started focusing on mental health. And one of the biggest issues in mental health is the lack of experts and clinicians in the field. Even if you were to fund access to mental health. You couldn't have it because we just don't have the trained individuals to do it. So first of all, we need to do that. You're absolutely right, the connection with a certain percentage of the homeless population. Because if you remember, in the 60s, when they closed the mental hospitals, what did they do? They just turned the people out into the streets. And that's what we have today. And there will come a time when we need to start talking about humane places where these people who have mental health issues can be serviced, taken care of. But, you know, for a whole variety of reasons, that conversation has not taken place. But the issue of mental health, drug addiction, alcoholism is tied to that, you know, to homelessness extensively. But keep in mind that that's about only 20% of the population, okay? It is not the totality. And one of the things I want to get across is that a lot of people don't want to be homeless. They do not. And when we talk about homeless, you're thinking about Skid Row. Think about the thousands that live in their cars. You know, think about the students that have a hunger issue and a homeless issue. It is a real serious problem, and that's what leads to mental health issues. So I'm very pleased that we have become to focus on, at CCF in our health portfolio, mental health is one of our priorities. And we're focusing on the availability, increasing the availability of professionals in that field.
And I have a couple thoughts on this. One is, again, just to be clear about this, most people fall into homelessness, which may trigger or exacerbate a mental health issues. Yeah. There are a lot of false assumptions around homelessness. So let's just say if we can keep people stably housed,
yes,
a lot of these other conditions do not manifest. So that is the number one prevention solution, is a home. Secondly, if people are experiencing homelessness, which is toxic stress and all the other things that come that exacerbate, a permanent home with supports is the most effective solution. So one of the important things in California policy is we've got a housing first perspective. So non-barriers you can get into or stay in a home. And secondly, the evidence-based solutions, a wonderful RAND study was done here, is the most effective way to address the problem as opposed to investing in these short-term emergency issues that put people perhaps into a shelter and then they fall right back on the street. So as you think about, I heard some donor advising investments, PRIs, different things, longer term solutions, and some of you are doing that in a very powerful way. The second thing I want to offer, which was so fun for me, well, I can say it's fun post Proposition 1 and 2 and the November experience, is we were able to do a multi-sector campaign, and that's my background. I come out of public health, there's very few resources, you do everything very creatively. So government, philanthropic, nonprofit, business were all a part of it. So we had tech industry, we had all the big healthcare institutions, we had labor, we had education, we had everyone at the table to both inform the process, advance the policy, because they saw that this made a difference for their folks. I worked with Kaiser and Dignity, all the big healthcare folks, and even the for-profits, and they said to me, we know that if we do not invest in housing for the people we serve, we're going to pay for it on the back end. We also know all our employees cannot afford to live near us. So everyone in, right? The everyone in LA campaigns make sense. The governor's talking about California, a California for all. It means we are all in to inform, we are all in to advance, and we want to ensure the people that are struggling the most are benefiting the greatest. So this is the time, this is our opportunity to make the changes we want to see in California, and we all need to be a part of that solution.
Thanks. Other questions out there?
Hello, Denise Tom from the California Community Foundation. It was suggested in one of our sessions this morning that there might be a little bit of complacency in California because we're a blue state, and that when you look at all the proposed rulings that have come down from the federal government, and this wasn't part of the session, but I'm just suggesting that we might be we're constantly in a defensive state. Very well prepared in that way, but how do you feel strategically about what the direction is as far as being more proactive or being more on top of what we think is going to be coming down in the next year or two.
Actually, I don't think we're complacent. I think that this is the state of innovation. There's a lot of hopefulness in government. There's a lot of openness of collaboration between philanthropy, the nonprofit sector, and business and government. Mm-hmm. So to me, this is a place of risk, of innovation. It is hard because we're swimming upstream as far as, sort of the federal level. I would say this. Let's think about census. Okay, by the end of June, the Supreme Court will have decided on whether to include the citizenship question. It's going to be, if it does, it's going to be a blow. What's going to happen to us in the state of California? We're going to double down. We're going to double down and do everything we can to make sure that all the residents of the state of California are counted. So to me is, we don't have a choice but to react in an efficient and an effective way to what's happening in Washington, and to be motivated. We get the government we vote for. So my view is, as a civil rights lawyer who has done voting rights, for 30 years, we got to get our tushy out there, and we got to vote.
Woo.
I mean, that's the only way we're going to change it. So, if you have to go to Wyoming or Arizona or the Dakotas, then go, because we need a different government that's more aligned, because California is the future of the country. We've just seen it earlier. And they're fighting it because they don't like what they see, but we in California love what we are.
And I will just build on your comments and offer that I think this is a moment of both and. What I see with our leadership and what I feel, having been working with state government now for 30 years inside the system and out, is the moment in time we're looking at long-term solutions. We're considering short-term fixes, but we're also building the base that we need across California. This is a big year of integrated voter engagement across California to prepare for 2020. The other piece I heard is we've got some leadership. We need all of us to help push the leadership in the place they feel uncomfortable. And for philanthropy that has perhaps felt more conservative or held back, this is your moment to consider, can you step up? Can you push your own envelope to help innovate, to help advance or push in places where your voice matters so much? This governor listens to you. This legislature listens to you, and it helps us move in very meaningful ways. So I encourage us to be optimistic, to see the opportunity as both and. We're going to create those long-term systems changes, undo all the discriminatory policies and practices, and we are positioned to also, because we have the capacity right now, to react to what's happening federally, react. And the other thing I want to mention to you is there is a National Low-Income Housing Coalition efforts nationwide that's funded by the Funders for Housing and Opportunity Collaborative. And it is a multi-sector coalition that is working at the national level to influence policy, but it is made up of us in the states. We're leading it for California, but we've got our organizing and our multi-sector power. So I think, and I see, that we are building what we need to continue to be the bright light, sustain what we need with the Trump bump and everything that's happening, and create the government and the democracy we need for 2020 and beyond.
Well, we have a theme that's cut across these two plenaries, the morning, and which has been about this opportunity for transformational change. And I just want to underscore something Lisa just said, which is we had the governor's cabinet secretary, Ana Mata Santos, at our conference 10 days ago, and she was delivering this message of we got to stop having either-or conversations, we got to have yes and conversations, and was underscoring that that's a priority as about how the governor thinks about this going forward. It also means, and they're not saying this yet, but it has to mean a connection to the revenue side of this, which Antonio mentioned earlier, because you can't say yes and without paying for things, and that means we're going to have a conversation about the equitable whether our tax system is equitable and what kind of opportunities there are that lie ahead for that. And last thing I just want to say is, great as this state is, we have great progress still to make. The closing speaker at our conference 10 days ago was Mayor Michael Tubbs from Stockton, California, and he had this very clear line that he closed out one of his comments for the day, which was, you can't be a progressive state if the poor people can't afford to live here. And so we have a lot of work to do in that regard. So please join me in thanking Lisa and Antonia for their comments.